what Minister Mbombo was talking about, that the garden route actually had a very delayed, low first wave. It had a very steep and early second wave, but it actually has a delayed and a steep third wave, which is actually quite different from the other areas. So it also just gives you the picture that once you see one picture for the province on top, you need to understand that it's a composite of multiple different pictures giving you the picture on top. This is our triangulation with wastewater. The city data is not quite available yet for this week, but what it shows in Breda Valley is that the concentration in COVID this week, actually, there's more COVID particles in the wastewater per milliliter in the Dorens, Rawsonville, Touws River and Worcester, which is commensurate to increasing in cases in the Breda Valley subdistrict. Theewaterskloof, it's more or less the same in Botterveer and Villiersdorp, but there's been an increase in Grabouw and Caledon. So what is our expectation of the third wave? So the South African Modelling Consortium has put this together. We reported on it last week. You'll see to the right bottom is the Western Cape. Those orange bars is the real admissions in hospitals. The blue bars are the projections. Now, if it is the dark blue bar is if we were very, very strict on observing a strong behavior response to this peak, we would have peaked our admissions already. If the light blue is we have complete disregard for behavior, we would have had a catastrophic, actually, much higher than the second wave above. We believe that the behavior response has been somewhere in between, and we are entering a period of peaking, which might happen in the next week or in the next 10 days. So this is also then the short-term South African COVID Modelling Consortium, because last week they predicted, you can see there the grey line in the middle. So you see 14 to July, that's the week before, it tracked according to the grey line. Then in the week that ended the 21st of July, there was a prediction that, the week that ended the 25th of July, there was a prediction that we will have fewer cases based on the delayed testing of the week before. The black dots actually is we had more cases in this past week than was predicted. Therefore, the adjustment for the next 2 weeks is slightly more cases. And therefore, it resulted in this picture. Last week, we reported that the consortium said, based on that picture of testing, and their rider was, if this was not influenced by the taxi violence and the restriction in testing, there was a 70% chance that we came over our peak already last week. Actually, what the reality is, we have not, and there's a 42% chance, so there's a less than 50% chance that we've peaked already. So that's why we're saying we have not peaked yet. We're likely to peak in the next 7 to 10 days. So the triggered wave response, we've always had this, a 4-trigger system. Unfortunately, we are at the peak of that 4-trigger system. It's in the dark red, where our health service capacity currently is threatened. It's under threat. We have more than 2,800 admissions. We're currently at 3,082. More than 80% of our high care, intensive care, high flow nasal oxygen and COVID beds are occupied. We are at 110%. More than 200% of pre-COVID hospital use in oxygen. We're currently at 39 tons per day for the public sector. That's more than a 200% increase. So what does that mean? We are in this thing called a mitigation paradigm. And therefore, we are very, very much now protecting the healthcare service. So as Minister Mbombo said, we still want people to behave and break the transmission. The second thing is our surveillance shifts to high-risk people that are at risk and who should be protected. The third thing is we've now scaled up our health platform capacity to its maximum to be able to cope with COVID. And it potentially could be quite threatened over this coming weekend. And then at the same time, we've scaled down other services, but we've maintained some very essential services, not to stop everything altogether. But probably the most important thing for me today is safeguarding and protecting the well-being of our staff, because it is our staff that's now right in the middle of this, what I would call the eye of a storm, eye of a perfect storm at the moment where they find themselves. And the Clear platform looks like this. You can see our public sector beds has now gone up to 1,800. 3,400 patients were admitted last night, 1,800 in the public sector. And we are edging closer to 2,000 public sector beds being used, which goes into a very, very red zone for the public sector. Private sector is at 1,638, and there's a stabilization. If you go to the third bullet, you'll see Brackengate Hospital of Hope currently has 274 patients. Their capacity is 338. You can see Mitchells Plain Hospital of Hope has got 88 patients, and an additional ward has been opened now. And we're still triggering to see whether the Frisia and Ward 99 would be needed into next week. Soonstraal already is at capacity at 63 patients, and our mass fatality center has 33 bodies, and people are working the way we've done in the first and second wave. This is our dashboard. The figure to the right is the one that is completely under constraint. So that is our occupancy for designated critical care beds. We are running at 110% critical care beds. So there is no capacity for anybody that's critically ill. I'll come back to this point, because if anybody is injured this weekend because of trauma, there is no capacity to manage anybody with a serious injury this coming weekend in the critical care capacity, because it's all been taken up by COVID. You can see the pressure across the various areas. And I think the point where we start really getting worried is that 30% of all patients in the public sector is currently COVID. A place like Paarl, it's 34%. A place like George, which Minister Mbombo is very concerned about, is already at 41%. So that means the health service in George and in the Garden Route is under severe pressure at the moment. And obviously there's danger this coming weekend. So this is the bed capacity we brought online, first wave compared to second to third wave. We potentially can stretch to 2,600 beds. As you see, we're entering close to 1,900, and we will probably be breaching 2,000 over this weekend. That is putting the system at severe strain in the public sector. Our ventilation capacity has gone up from the first to second wave, and we've brought on board additional high-flow nasal oxygen. As the units arrive, they get implemented. As the units arrive, they get installed. So we're working our way to 434 oxygen and ventilation points, high-flow nasal oxygen and ventilation points. Our combined use of oxygen is at 69 tons per day. The production capacity in Afrox is 70 tons a day. So we are at maximum production capacity for Afrox. Afrox has added some trucker, like they did in the second wave, of trucking in additional oxygen from a plant in Mossel Bay, which is a little bit closer than PE. Our public sector utilization is 39 tons, and you compare that to, so that is quite significant for the public sector. We have increased our capacity across public and private sector, and our utilization is being monitored. So our utilization of oxygen is not currently threatened, but we're watching it at maximum capacity as we go. The trauma is the big story for us, and this picture just tells you that during alert level 2, when there were no restrictions on alcohol, it's the first orange bar. When we had adjusted alert level 3, it introduced some restriction on alcohol, and that's mainly the Monday to Thursday one, similar one where we are back into now, and that reduced some trauma emissions. When we were in alert level 4, which was complete prohibition of alcohol, we saw significant declines in alcohol presentation against the already reduced baseline. The recent taxi violence, which was last week, the week before, there was some increase in trauma, which we reported last week. And what we're about to show you now is that overall in that alert level 4, we actually had a 30% reduction in trauma, and we had a 37% reduction in weekend peaks, which is when the pressure is the highest. If we look at the unrest, the impact on the taxi violence, week on week, it is now reduced back. So there was an 8% decrease and 11% decrease last week to this week, which basically means that impact, that blip that we had because taxi violence is now out of the system. The challenge, although, for us is the recent adjusted level 3 now allows for the partial availability of alcohol from Monday to Thursday this week. And it now coincides with the end of month weekend, which under normal conditions tends to be the peak for trauma admissions. So we're entering an end of month with alcohol restrictions lifted during the week and more alcohol availability, at the same time with the healthcare system being at its maximum capacity. So there will possibly be significant implications for the system this weekend. This is our staffing, and it's really just about the gap of existing staffing, onboarding additional capacity. So when people become infected, that we fill the gaps and we rotate staff and then vaccinate our staff. So this is a dashboard that we look at all the time. So in terms of this, we have brought additional staffing online, 804 for COVID, 1,147 healthcare workers and support staff, and which includes 442 interns for vaccination. We've also extended contracts until the end of September. We've brought additional staff online for CTICC and for Athlone, and we can still process additional applications. But this is our staffing situation. But the big thing for us is to care for our staff. And that's really a call that the Minister and the Premier made to you today, is really to be mindful that the same staff that's vaccinating and looking after COVID and everything else is the same staff that's taking all these pressures. And it's really, we've done on-site counseling for employee well-being, and we've really motivated our staff to be able to cope with what's coming at them. And then the vaccination drive has been a positive story amongst our staff, which I will show you a little bit later. So this is the additional capacity we've brought online. And then the positive story really for staff is the story of the vaccination of healthcare staff in the Western Cape Department of Health. If you look at July, we have 967 reported cases of COVID amongst healthcare staff. If you compare that to June last year, which was 1,900, that was the peak of the first wave, and 2,300 in December, 2,322. You compare that 967 to that, it is significantly lower. And we can see this is one that actually really, this shows us the active cases we have, 500. At the peak, we had about 1,200 in December, active cases. But you can see that we're peaking at about 76 cases per week compared to 136 in the first wave and 199 per week at the peak of the second wave. That's the impact of vaccination. If anybody wants to have a story of whether vaccinations work, and that is besides the fact that our healthcare workers are less ill that become infected, and less hospitalizations and less deaths. So that brings us to the vaccine update. And really the vaccines for us is probably the most important thing to mitigate a third wave that we're going through now. And that is to mitigate the next possible wave, which is a fourth wave. More people are vaccinated, the less infections there will be, the less people requiring hospitalization, therefore the less people dying. So this is the 4 groups that we will see. 3 groups is phase 2. So over 60, 50 to 59, and then 35 to 49. And then the third, phase 3, which is then 18 to 34, which is 2 million people. So you can see that the registrations are opened, and for over 18s, it will open on the 1st of September. So this is the adjusted timelines because it's been brought forward. Our priority in this province is still over 60, first dose is our top priority. Second priority, over 60 coming for the second dose, then over 50 to 59 for their first dose, and then 35 to 49-year-old for their first dose. And this is the updated vaccine supply line. You'll see the last 2 dates. It's tomorrow's dates, that we're getting 90,000 doses of Pfizer tomorrow. Minister Mbombo has said that there will be increased J&J supply that will start early next week. So that 33,000 that we expected for J&J by tomorrow is likely to come early next week, but it is likely to be a higher number than 33,000. So we are really opening and waiting for the J&J supply to open starting early next week, and then that the expected vaccine delivery for the coming weeks from that point onwards. So there will still be pressure for next week, but the week after we will then have more J&J and more Pfizer, and that is actually supposed to increase our supply from early to mid-August onwards. This is our sites. You bring the 203 sites is active. As Premier said, we can activate 293 sites and run at full capacity. At the moment, because of vaccine supply constraints, we're running 203 sites, and at the sites, we have to ration and make sure that we have enough amounts that we don't run out completely. In addition to those 203 sites, there's 118 private sites, so that takes us over to more than 320 active sites, public and private, in this province. And there's some workplace sites also being added into that. If you look at the weekend, this coming Saturday, last weekend we did 2,500 vaccinations on a Saturday alone at 6 sites. This weekend we're planning to go to 10 sites. These are the sites, and we will incrementally, again, we will be constrained by how many vaccines we have available for this Saturday. But as the vaccine supply increase, our weekend availability of vaccinations will also increase. Private sector sites is 118. 85 of those in the metro, 33 in the rural, and the rural sites are starting to increase. By far, the majority of private sector sites is click pharmacies. It's 76 of the 118, but there are other range of sites. This is where we are. This week, we've hit 1 million vaccinations in this province. We're currently at 1,072,000. And for the first 3 days of this week, we already achieved 96,000. That is in the face of constrained vaccine supply. You'll see that we've continually pushed, and we're at the last week of this constrained vaccination, but we continue to push to reach above 150,000. 73% of that is public sector, 27% is private sector. And this is just graphically shown. You can see that our supply, we were kind of aiming to hit between 120 and 130 for the last 2 weeks. We have now done 133,155, and we actually did 160 last week. This week, we probably hit 150,000 again. As we said, from next week onward and the week after, we're looking for another step up of increase of our vaccination. Fully vaccinated, we now have almost 360,000 people fully vaccinated. And that is either a Johnson & Johnson vaccine or a second dose of Pfizer vaccine. So you can now start seeing that almost 190,000 people have already got their second dose for Pfizer to bring this up to that figure. Last week, a question was asked. So our figures show that almost 59% of people vaccinated are women in this province, and only 41% are men. And that's obviously a phenomenon we're looking in terms of differential presentation for vaccination. The rollout of the essential program in the public sector, just to indicate, we've completed the education sector. We're busy with the social development sector. But then all public sector employees will just go via the normal program, and there will be no special programs. There are a few private sector special programs that is also been activated, but all of them are coming to an end. And in a sense, everybody has been given permission or has been activated to go into existing sites rather than parallel sites on the system. CTICC, from its started of business of 28th of July till now, it's already done 23,000 vaccinations. It is doing about 2,500 vaccinations per day. It's got the capacity to go to 4,000, but because of vaccine constraint, we've not increased the supply to CTICC because we needed to make sure that there's fair distribution to other sites as well. We are also working towards Athlone. So Athlone will open mid-August. It coincides with an expected increase in vaccine supply because we can only put the vaccines into mass sites if we can guarantee that there is equal access or equity in access to vaccines to all sites across the province. This is our current strategic focus as we very, very strongly want to promote equity. And this is really about increasing access to registration and vaccination sites, community level interventions, which Minister Mbombo has been spearheading for us, focus on identified geographic areas as she's going to Mitchell's Plain currently, and then the demand creation, which is to retain the focus on over 60s as the most vulnerable group, neutralize misinformation, and strengthening the pro-vaccine voices. We're very glad to have Professor Linda-Gail Bekker with us today. And then scaling up our capacity, mass sites, pop-up site, weekend operations, and then continue to mitigate the risk and managing the risk very strategically in relation to the vaccine program. We have something that we're very proud of. It's called the Vaccine Cascade. We now have data that we can break down to each geographic area and tell the story. We can call it the Vaccine Cascade story that we can tell. And this story we can tell for over 60s. You will see how many people are 720,000, how many has been registered. Now 64% has been registered. But the big story this week actually is partially vaccinated is now getting less. Last week it was 58% partially vaccinated. This week is 33%. Last week we had fully vaccinated, only 12%. This week we have 24%. And in the next 2 or 3 weeks, the fully vaccinated will overtake the partially vaccinated as more people get their second doses. And the idea is at the bottom line here is we want to get to 70% of all people over 60 have been, more than 70% has been fully vaccinated. That is our first program objective, equitably across the province. You can see that breakdown in each geographic area. The highest proportion of people over 60 that has at least had one dose or are closing to that of vaccine is Overberg, because 73% of the people in Overberg has at least had one dose or are fully vaccinated together. Followed by Klipfontein, followed by Southern, and you can see the lowest is Mitchells Plain, only 31%. That's why the attention that Minister Mbombo is giving to the Mitchells Plain area and all of us to raise that in terms of equity. Then you repeat that same cascade, tell the same story for 50 to 59. And you can see from these figures, we have prioritized over 60s because 50 to 59 is lower uptake and lower fully vaccinated, but still good figures in certain areas. And then you can tell that for 35 to 49 is our third priority. So our figures are showing that we are vaccinating in accordance with our prioritization. And obviously we'll add 18 to 35 after the 1st of September. This also gives us what is our coverage. This coverage on top is public sector only. We've covered in terms of the vaccination coverage achieved with that. And if you add the private sector, what is the total vaccination coverage achieved? The interesting thing here is when you go to full coverage over 60, public and private together, you'll see the impact in the city of Cape Town. Because with public sector doses alone, we've achieved 40% of coverage of people in the metro. If you add the private sector, we go to 54%. But that means still what we've done is we've been able to redirect public sector doses commensurate to private sector doses to get rural metro equity across the area. Because as I said, the biggest uptake over 60 is actually in Overberg, followed by Garden Route, followed by West Coast, Cape Winelands. And if you add the private sector in, it is still Overberg, Garden Route, West Coast, and then only the metro, followed by Cape Winelands. If you then say, what have we learned? We've learned this issue of equity. It's the issue about the rural versus metro. It's the issue about insured versus uninsured. It's about excess of over 60s versus other age group. And also the importance of having a differentiated and targeted strategy. We need to go outreach into low uptake areas in the metro, and we need to increase private sites in the rural and have targeted outreach. And then the importance of communication, what to expect, simplifying the process, make it easy for people, but also the importance of being vaccinated to counter the misinformation and hesitancy. So our registrations currently look like the following, and that is, if you look at over 60s, Overberg, 91.9% of everybody over the age of 60 has been registered in Overberg. That's why Overberg has got the highest proportion of people over the age of 60 having been vaccinated at least, followed by Garden Route and West Coast. If you look at the lowest, if you go to the metro, that is also sub-districts that is high. But if you look at all the age groups together, in the rural area, Central Karoo is still the lowest of all the rural districts. And if you come to the metro, Khayelitsha and Mitchells Plain is still the lowest for everybody vaccinated in the different age groups. Our communication is to continue keeping the message for safety, is the vaccination messaging, managing expectation and where we are. The 1 million doses administered, the ECD sector, balancing the supply with the demand, reducing the access to the vulnerable. This is from outreach going into places where it's needed most. And then thank you for adding the voices of multiple people that has come forward and became vaccine ambassadors. If all of us are vaccine ambassadors, we can really turn the tide against COVID. In conclusion, we are experiencing now a flattening of this third wave, but we need to strictly adhere to protective behaviors. We have revised our response to the third wave. We need a whole government, a whole society approach to flatten it. And we've scaled up our vaccine capacity. We can now, when we get more vaccines, actually vaccinate more people. And we will now need to continue to mobilize and assist everyone over 35, but then from the 1st of September, also prepare for the over 18s, but keeping equity in mind as the key driver for our vaccination drive. Thank you very much.
Thank you very much, Dr. Klitty. We will now hand over to Professor Bekker to provide us with her presentation.
Thanks, Kyla. I'll just pull that up. Hopefully everyone can see that. Is that good?
We're not able to see it as yet.
Oh, that's a shame. Let me see what's happened. We did manage that a minute ago. Let me see again. That's it. How's that?
Yes, we can see your presentation.
Great. And it's in the let me put it in the presentation mode for you.
Thank you very much,
Okay.
Professor.
There we go. Right. Hi, everyone. And my task today in just 10 minutes is to give you an update on where we are with Sisonke, and also give you a little bit more feedback on the single-dose AD26 or J&J vaccine as we know it. So just to remind you all again that the Sisonke 3B trial was the administration of a single-dose AD26 vectored spike vaccine to more than 500,000 healthcare workers, which was undertaken between the 17th of February with the final vaccination being given on the 16th of May. We based that on the Ensemble Phase 3 efficacy trial, which was partially conducted here in South Africa. And if you remember, overall, that vaccine for infection showed a 66% reduction in infection. Here, this was...
We're coming out of that delivery by the Western Cape government, an update on vaccination in the process. Dr. Tutu talking there about vaccine supply constraints. But let's take you